Welcome back to Men's Health 365. Today we're discussing something that could save your life or the life of someone you love. Every 40 seconds, someone in the United States has a stroke. Every 3.5 minutes, someone dies from a stroke. But here's what most people don't realize. Strokes are not instant death sentences. The faster you recognize the signs and get treatment, the better your chances of full recovery. In fact, if you get treatment within the first 3 hours, you can dramatically reduce permanent brain damage and disability. The problem is that most people, especially men over 60, either don't recognize the warning signs or they dismiss them as something less serious. That delay can mean the difference between walking out of the hospital on your own 2 feet or spending the rest of your life in a wheelchair, or worse. Before we dive into the critical warning signs you need to know, hit that subscribe button right now. This channel exists to give you life-saving information that keeps you healthy, strong, and independent as you age. We upload new content every week, and today's video might be the most important one you ever watch. Let me tell you about David Martinez, a 68-year-old construction contractor from Austin, Texas. David was working in his garage one Saturday afternoon when he suddenly felt dizzy and noticed his left hand wasn't gripping his tools properly. He figured he was just tired from a long week of work. He sat down, drank some water, and rested for about 20 minutes. The weakness seemed to improve slightly, so he went back to work. Over the next 2 hours, he developed a mild headache and noticed his speech was slightly slurred, but he convinced himself he was just dehydrated and maybe coming down with something. His wife came home 3 hours after his initial symptoms and immediately noticed something was wrong. She insisted on taking him to the emergency room despite his protests. By the time David reached the hospital, he'd missed the critical 3-hour window for the most effective clot-busting treatment. He'd had an ischemic stroke caused by a blood clot blocking blood flow to part of his brain. Doctors were able to provide treatment, but the delay meant more extensive brain damage. David spent 2 months in rehabilitation, learning to walk again and regain use of his left arm. His speech required intensive therapy. Today, 18 months later, David has recovered about 70% of his function, but he lives with permanent weakness on his left side and ongoing speech difficulties. The tragedy is that if he'd recognized the warning signs immediately and gotten to the hospital within that first hour, he likely would have made a complete recovery with minimal or no permanent damage. David's story is heartbreaking, but incredibly common. Research published in the Journal of the American Heart Association found that the average person waits nearly 24 hours before seeking help for stroke symptoms, and men wait even longer than women. This delay is deadly. Brain cells die at a rate of nearly 2 million per minute during a stroke. The saying in emergency medicine is time is brain, and it's absolutely true. Every minute you wait, you lose more brain tissue that controls movement, speech, memory, and everything that makes you who you are. Today, I'm going to teach you the definitive warning signs of stroke using multiple recognition methods, explain the different types of strokes and their unique symptoms, show you the silent warning strokes that predict major strokes, give you the exact steps to take the moment you suspect a stroke, and explain the treatments available and why timing matters so desperately. By the end of this video, you'll have the knowledge that could save your life or help you save someone else. Let's start with the most widely recognized stroke detection method, the FAST test. FAST is an acronym that stands for face, arms, speech, and time. This simple test can be performed by anyone, anywhere, in less than 60 seconds. Face, ask the person to smile. Does one side of the face droop or feel numb? Is the smile uneven with one side not moving as much as the other? A stroke often causes sudden weakness or paralysis on one side of the body, and facial drooping is one of the most visible signs. Arms, ask the person to raise both arms. Does one arm drift downward, or is the person unable to raise one arm at all? Stroke-related weakness typically affects one side of the body, so if one arm can't stay raised or drifts down while the other stays up, that's a critical warning sign. Speech. Ask the person to repeat a simple sentence like the sky is blue. Is their speech slurred, strange, or difficult to understand? Can they repeat the sentence correctly? Stroke can affect the part of the brain that controls language and muscle coordination for speech. Time, if you observe any of these signs, even if they seem minor or temporary, call emergency services immediately. Time is critical. Note what time the symptoms started, as this information is crucial for treatment decisions. Research from the National Institute of Neurological Disorders and Stroke shows that using the FAST test increases the likelihood that bystanders, and even patients themselves, will recognize stroke symptoms and seek immediate help. A study published in Stroke Journal found that communities where FAST was widely taught had significantly better stroke outcomes because people arrived at hospitals faster. But FAST doesn't cover all stroke symptoms. There's an expanded version called BEFAST that adds 2 more critical warning signs. The B stands for balance. Is the person suddenly having trouble with balance or coordination? Are they dizzy, stumbling, or unable to walk in a straight line? Sudden loss of balance or coordination, especially when combined with other symptoms, can indicate a stroke affecting the cerebellum, the part of your brain that controls movement and coordination. The E stands for eyes. Is the person experiencing sudden vision problems? This could be blurred vision, double vision, or complete loss of vision in one or both eyes. Sudden vision changes occur because stroke can affect the parts of the brain that process visual information or the optic nerve itself. A study in the Journal of Stroke and Cerebrovascular Diseases found that adding balance and eye symptoms to the basic FAST test increased stroke detection rates by 18%, catching strokes that would have been missed using FAST alone. These additional symptoms are particularly important for detecting posterior circulation strokes that affect the back part of the brain, which controls balance, coordination, and vision. Beyond BEFAST, there are additional stroke warning signs that every man over 60 needs to know. Sudden severe headache with no known cause is one of the most serious. We're not talking about a regular headache or even a bad migraine. A stroke-related headache is often described as the worst headache of your life, coming on suddenly like a thunderclap. This type of headache is particularly associated with hemorrhagic stroke, where a blood vessel in the brain ruptures and bleeds. Research published in Neurology indicates that sudden severe headache is present in over 50% of hemorrhagic strokes. If you experience a sudden, explosive headache unlike anything you've felt before, especially if accompanied by any other stroke symptoms, this is a medical emergency requiring immediate attention. Sudden confusion or trouble understanding others is another critical sign. You might suddenly find yourself unable to comprehend what someone is saying to you, even though you can hear them clearly. Or you might become confused about where you are, what time it is, or what you're supposed to be doing. This cognitive disruption happens because stroke affects the parts of the brain responsible for processing information and maintaining awareness. A study from the American Academy of Neurology found that sudden confusion was present in 32% of stroke cases, but was often dismissed by patients as a senior moment or temporary mental fog. Sudden numbness or weakness, especially on one side of the body, extends beyond just the arm. You might experience numbness or weakness in your leg, your face, or an entire side of your body from head to toe. Some people describe it as feeling like half their body has fallen asleep, or as if they're dragging one side. This unilateral weakness is a hallmark of stroke because most strokes affect one hemisphere of the brain, which controls the opposite side of the body. Research in the Journal of Neurology shows that unilateral weakness is present in approximately 75% of all strokes. Sudden trouble walking, loss of coordination, or stumbling can occur even without obvious weakness. You might feel clumsy, unable to coordinate your movements, or as if the ground is moving under your feet. Your gait might become wide and unsteady, or you might find yourself veering to one side when trying to walk straight. These symptoms indicate possible stroke in the cerebellum or brainstem, areas that coordinate movement and balance. Now let's discuss something critically important that most people have never heard of: transient ischemic attacks, or TIAs, also called mini strokes or warning strokes. A TIA produces stroke symptoms that last anywhere from a few minutes to a few hours, but then completely resolve, usually within 24 hours. Because the symptoms go away, most people breathe a sigh of relief and never seek medical attention. This is a catastrophic mistake. Research published in the New England Journal of Medicine found that approximately 15% of people who have a TIA will have a major stroke within 3 months, and half of those major strokes occur within the first 48 hours after the TIA. Think about that. If you have stroke symptoms that go away, you have a 1 in 6 chance of having a major, potentially devastating stroke within the next 3 months, and half the time it happens within 2 days. A TIA is your brain's fire alarm. It's warning you that you have a serious problem with blood flow to your brain, whether from blood clots, narrowed arteries, or other vascular issues. The fact that symptoms resolved doesn't mean the problem resolved. It means you got lucky this time. The blood flow was restored before permanent damage occurred, but the underlying condition that caused the TIA is still there, waiting to cause a full stroke. A study from Stroke Journal tracked over 4,000 TIA patients and found that those who sought immediate medical attention and received treatment had their stroke risk reduced by 80% compared to those who ignored their TIA. Treatment after a TIA might include blood thinners, medications to control blood pressure and cholesterol, procedures to clear blocked arteries, or surgery in some cases. These interventions can prevent the major stroke that would otherwise be coming. David Martinez, the man I told you about at the beginning, actually had a TIA 2 months before his major stroke. He'd experienced 15 minutes of left arm weakness and slurred speech while watching television one evening. By the time he decided he should probably go to the hospital, the symptoms had completely resolved. He felt fine, so he never went. He never told his doctor. 2 months later, the major stroke hit. If he'd sought treatment after that TIA, his major stroke could likely have been prevented entirely. So I want to be absolutely clear about this. If you experience any stroke symptoms, even if they last only a few minutes and go away completely, you need to call emergency services or get to an emergency room immediately. A TIA is not something to be relieved about. It's a medical emergency and a critical warning that you need immediate evaluation and treatment. Now let's talk about what actually happens during a stroke and why time is so critical. There are 2 main types of strokes, ischemic and hemorrhagic. Ischemic strokes account for about 87% of all strokes. They occur when a blood clot blocks a blood vessel in the brain, cutting off oxygen and nutrients to brain tissue. This can happen because a clot forms directly in a brain artery that's been narrowed by fatty deposits, or because a clot forms elsewhere in the body, often in the heart, and travels to the brain. Without oxygen, brain cells begin dying within minutes. The core area where blood flow is completely blocked dies quickly, but there's a surrounding area called the penumbra, where blood flow is reduced, but cells are still alive. This penumbra is savable if blood flow is restored quickly enough. The primary treatment for ischemic stroke is a clot-busting drug called tissue plasminogen activator, or TPA. This medication can dissolve the clot and restore blood flow, but it must be given within 3 to 4.5 hours of symptom onset, and the earlier the better. Research published in The Lancet shows that patients who receive TPA within 90 minutes of symptom onset have significantly better outcomes than those treated even an hour later. Some patients are also candidates for mechanical thrombectomy, a procedure where doctors thread a catheter through blood vessels to the brain and physically remove the clot. This can be effective up to 24 hours after symptom onset in select cases, but again, earlier is always better. Hemorrhagic strokes account for about 13% of strokes, but are more likely to be fatal. They occur when a blood vessel in the brain ruptures and bleeds, either into the brain tissue itself or into the space surrounding the brain. The bleeding increases pressure inside the skull, damages brain tissue, and deprives areas of the brain of oxygen-rich blood. Hemorrhagic strokes are often caused by high blood pressure that weakens blood vessel walls over time, or by aneurysms, weak spots in blood vessel walls that balloon out and can rupture. Treatment for hemorrhagic stroke focuses on controlling the bleeding, reducing pressure in the brain, and managing blood pressure. Surgery may be needed to repair the ruptured vessel or remove accumulated blood. Knowing which type of stroke someone is having matters because the treatments are different. This is why getting to the hospital immediately is so critical. Doctors need to perform imaging studies, usually a CT scan or MRI, to determine what type of stroke is occurring before they can provide the right treatment. You cannot tell from symptoms alone whether someone is having an ischemic or hemorrhagic stroke. Both can present with identical symptoms. This is another reason why you should never wait to see if symptoms improve. Every minute wasted is brain tissue lost. Now let's discuss risk factors, because understanding your personal risk can help you take preventive action and remain vigilant for symptoms. The biggest risk factors for stroke in men over 60 include high blood pressure, which is the single most important risk factor. High blood pressure damages and weakens blood vessels throughout your body, including in your brain, making both ischemic and hemorrhagic strokes more likely. Research from the American Heart Association indicates that controlling high blood pressure can reduce stroke risk by up to 48%. Atrial fibrillation, an irregular heartbeat, dramatically increases stroke risk because the irregular rhythm allows blood to pool in the heart and form clots that can travel to the brain. Studies show that atrial fibrillation increases stroke risk fivefold. Diabetes damages blood vessels and increases the likelihood of blood clots. High cholesterol contributes to atherosclerosis, the buildup of fatty deposits in arteries that can lead to clots or reduced blood flow. Smoking doubles your stroke risk by damaging blood vessels, increasing blood pressure, and making blood more likely to clot. Obesity, particularly abdominal obesity common in men, increases stroke risk through multiple mechanisms, including raising blood pressure, promoting diabetes, and increasing inflammation. Physical inactivity and poor diet contribute to most of the other risk factors. A sedentary lifestyle and diet high in processed foods, sodium, and unhealthy fats promote obesity, diabetes, high blood pressure, and high cholesterol. Previous stroke, or TIA, dramatically increases your risk of another stroke, which is why post-stroke care and prevention are so critical. Family history of stroke, especially in parents or siblings, increases your risk. While you can't change your genetics, knowing you have family history should make you more vigilant about controlling other risk factors. The good news is that approximately 80% of strokes are preventable through lifestyle changes and medical management. Research published in Circulation found that men who maintained 5 healthy lifestyle factors, normal weight, not smoking, regular physical activity, moderate alcohol consumption, and healthy diet had a 69% lower risk of stroke compared to men with none of these factors. If you have risk factors, work with your doctor to manage them aggressively. This might include medications for blood pressure, cholesterol, or diabetes, blood thinners if you have atrial fibrillation, lifestyle modifications including diet and exercise, regular monitoring of your numbers through blood work and blood pressure checks, and in some cases, procedures to open narrowed arteries before they cause a stroke. Let me give you the exact action plan for what to do if you or someone near you shows any signs of stroke. First, immediately call emergency services. Do not wait to see if symptoms improve. Do not drive yourself or have someone drive you to the hospital. Call for an ambulance. Paramedics can begin life-saving treatment on the way to the hospital and can alert the emergency room that a stroke patient is coming so they can prepare. This saves precious time. Second, note the time when symptoms first appeared. This is critical information for determining treatment eligibility. If you wake up with symptoms, the time is considered to be when you last felt normal. Third, if the person is conscious, have them lie down with their head slightly elevated. Do not give them anything to eat or drink, as stroke can affect swallowing and they could choke. Fourth, stay with the person and monitor their breathing and consciousness. If they become unconscious, position them on their side to prevent choking if they vomit. Fifth, gather their medications to bring to the hospital. Knowing what medications someone takes helps doctors make treatment decisions. Sixth, remain calm and reassure the person. Anxiety can raise blood pressure and potentially worsen outcomes. What you should not do is equally important. Do not wait to see if symptoms improve. I cannot stress this enough. Even if symptoms are mild or seem to be getting better, call emergency services immediately. Do not take aspirin or any medication unless directed by emergency services. While aspirin can help in ischemic stroke, it can be dangerous in hemorrhagic stroke. Only medical professionals with imaging results should make this decision. Do not eat or drink anything. Stroke can affect your ability to swallow safely, and you may need emergency procedures that require an empty stomach. At the hospital, doctors will move quickly to diagnose the type of stroke and begin treatment. You'll receive imaging studies to determine whether the stroke is ischemic or hemorrhagic. If it's ischemic and you're within the treatment window, you may receive TPA or undergo mechanical thrombectomy. Your blood pressure, blood sugar, and other vital signs will be carefully managed. You'll be monitored intensely for the first 24 to 72 hours, as this is when complications are most likely. Once you're stable, rehabilitation will begin, often while you're still in the hospital. After discharge, you'll likely continue with outpatient rehabilitation and medications to prevent another stroke. Recovery from stroke varies enormously depending on how quickly treatment was received, which part of the brain was affected, how extensive the damage was, and how aggressively you pursue rehabilitation. Some people make complete recoveries with no lasting effects. Others have permanent disabilities affecting movement, speech, cognition, or other functions. The research consistently shows that people who receive treatment within the first hour, often called the golden hour, have the best outcomes. Before we wrap up, I want to emphasize that knowing this information isn't enough. You need to share it. Talk to your spouse, your children, your friends about stroke warning signs. Make sure the people around you know what to look for and what to do. Stroke doesn't just affect the person having it, it affects everyone who loves them. You could save your own life with this knowledge, or you could save your wife, your brother, your best friend. Statistics show that men are more likely to have strokes at younger ages than women, and men are more likely to die from strokes. We're also more likely to ignore symptoms and delay seeking help. Don't be that statistic. Your life is too valuable, and the people who love you need you healthy and present. Now I want to hear from you. Drop a comment below letting us know what country you're watching from. We have viewers from all over the world, and I love seeing this global community of men committed to better health. And please, hit that subscribe button. This information saves lives, and by subscribing and sharing, you help us reach more men who need to know this. Remember, stroke is a medical emergency. Every second counts. Know the signs. Act immediately. Your life or someone you love depends on it.